So this presentation is going to be an introduction to motivational interviewing. So it's not going to give you a lot of detail. It's just going to kind of be the nuts and bolts. And then as you move throughout the next two modules, you'll get additional detail, and then you'll also get example videos and then opportunities to practice. And that's the key to motivational interviewing, I think, is, the concepts aren't that hard, as you'll see. But it's putting it into practice is probably the challenging part. So that'll be the key part, is being able to get opportunities to actually try out some of these techniques with your classmates, but then also hopefully patients that you might be seeing in care. So as we've discussed already, addressing problematic health behaviors is a big part of our job. That can be poor diet, lack of activity, smoking, any of those problematic health behaviors. That's really part of our role, is to help patients address those issues. And simply sharing information, telling patients about the risks and providing some statistics and things like that is not very effective. And that's usually our kind of first blush of trying to get people to change, is to say, hey, do you know that that increases your risk for a heart attack, or that increases your risk for diabetes, or whatever it may be. And simply providing information, even though it's intuitive that would be helpful, it's really not that effective. Same thing with confronting patients, getting after them a little bit about a negative health behavior, or even scare tactics, don't that'll put you at risk, or something like that, aren't very effective at best. And actually, there's a lot of evidence that when we try to confront patients, or we may use scare tactics or things like that, patients actually become entrenched in the negative health behaviors. So if they were in this state of ambivalence, which just means they see some reason to change and some reason to stay the same, if we kind of confront them and come at them in more of an authoritarian approach, like we're the expert and we're telling them what to do, it's actually, the tendency is for people to get more entrenched in the health behavior. And so on the right here is an example, where we're working with a patient and we're trying to encourage them to stop smoking. And you can kind of see two different approaches here. One is on the top is, hey, your breathing is never going to get better unless you stop smoking. Don't you know how bad smoking is for you? Do you want to end up on a ventilator? So, it's sharing information, it's confrontational, and it's scare tactics. If that patient probably in their mind is like, yeah, I know, there's a lot of reasons not to smoke. I've been smoking for a long time, but there's a lot of reasons I should quit, especially now. That patient, if we approach them in this manner, with very confrontational and making them feel bad about the health behavior and stuff like that, the natural tendency for them is going to be, who are they to tell me to stop smoking? I'm not listening to them, right? A more effective approach may be something like this. Hey, you've mentioned you smoke. How do you think smoking contributes to your breathing difficulties? Have you ever considered trying to smoke? And if you have, what are some of the barriers? You can see that it's much less confrontational, and you could imagine a patient that's in that state of ambivalence where they're like, maybe now's the right time to stop. I can see some of the issues, is more likely to get into a conversation about change if we use this bottom approach versus if we use this more confrontational top approach. And so again, motivational interviewing is, and we'll talk about this in more detail coming up, is really about an approach to communicating with patients. And this is, William Miller was one of or really the primary person who really came up with the idea, or started to formalize the idea of motivational interviewing. And he has this nice quote, which I think sums up this slide, is really the person rather than the clinician should make the arguments for change. So instead of us coming at the patient and saying, here's a million different reasons why you should change your health behavior, his idea is, okay, let's elicit some of the patient's own arguments for why they should change. And it's just natural tendency for people to listen to their own arguments more than they'll listen to anyone else's arguments. We tend to listen to ourselves when we're encouraging change and stuff like that, versus listening to others, even if they're experts on the topic and things like that. And that's a lot of the techniques we're gonna talk about in the next few slides, is really going to be, okay, how do we effectively do that? Is get the patient to a point where they're actually arguing for change. And just as an example, just because it's timely, you've probably seen a lot of this play out in the last couple of years with respect to vaccinations. a lot of the information, some people have been hesitant to get vaccines for COVID-19. And, the approach has been primarily to, share information, sometimes to confront patients, and sometimes to use scare tactics, right? And we know that that has not been very effective. There's a lot of people that are still entrenched with, hey, I'm not going to get vaccinated, regardless of what information comes out. And I'm less likely now that I feel like I'm being judged and that, people are kind of telling me what to do. So we've had an excellent case example of, how these kind of traditional approaches aren't very effective for changing health behaviors. So another timely example for how this has kind of played out. So before we move forward, I think it's just important for us to acknowledge that changing your health behaviors is hard, not easy. And rarely is it due to a lack of information. A lot of times, whether that be smoking or diet or activity or, managing your blood glucose, whatever it may be, it's rarely the case where patients don't have the information that's necessary to make a change. So it's rarely that you'll give them the information and they'll say, "Oh, I never knew that was bad for my health," right? Or that was associated with a poor health outcome. And so if it is, and the patient just truly doesn't have the information needed, the fix is usually easy, right? Because you can just say, "No, this is the information. This is associated with a bad outcome," and they'll say, "Okay, I'll change tomorrow," right? But that's rarely the case. Most of the time, our patients know that what they're doing is associated with poor outcomes. And it's going to be more difficult than just simply providing them with information. A resistance to change is also usually not associated with laziness, where they just don't have what it takes to do it, or denial, where they just don't think it's a problematic health behavior. It's really just comes down to the fact that changing your behavior is hard. And, consider your own health behaviors, maybe something you've tried to change in the past or are currently in the process of changing. For myself, I'm kind of in the process of trying to change some of my sleep habits and stuff like that. It isn't easy, right? There's going to be, stumbling points, and you're going to make some progress, and then you're going to kind of relapse a little bit and things like that. It is not easy. And the more we acknowledge that this is what our patients are trying to do is very difficult, I think the more empathy we can have for them as they may struggle. And it's important for us as healthcare providers to understand this and avoid labeling and judging patients. For us as therapists, a lot of times we'll, prescribe home exercise programs, or we'll encourage patients to be more physically active. And you know this, or you've probably seen this play out already, that a lot of patients won't do what we kind of prescribe for them to do at home, even though we know and they know that it's probably associated with, it's probably in their best interest to do some of these things, increase their general activity or do some of the, therapeutic exercises we may prescribe them. They still may struggle to get into the habit of doing that. And instead of just saying, well, that patient's lazy or they're non-compliant, even that's a label with negative connotations, right? And judging them for that, that really doesn't get us anywhere, right? What we kind of need to do is say, okay, we're not getting the intended outcome. That's associated with a poor health. That behavior is associated with a potentially poor health outcome. Now we need to think back and say, okay, what are the barriers and what are some of the sticking points that are stopping this patient from changing the health behavior? Is it truly, just a lack of information, or is it more of a lack of motivation to change? We really need to be detectives a little bit and dig into that. And again, knowing that this process of change is hard, instead of judging and labeling patients, we really need to spend our time focusing on how we can support people as they work to change. Again, because it is not going to be easy, and a lot of our patients are going to struggle. Now let's get into some of the more specifics of motivational interviewing. So what is motivational interviewing? So kind of a more technical example, it's a collaborative conversation style for strengthening a person's own motivation and commitment to change. So there's two parts of this, and William Miller, again, the guy who kind of conceptualized this, was kind of strategic about the name. He called it motivational interviewing. Motivational, since the goal is to motivate people to change. We're essentially working with people who a lot of times are in a state of, again, what we describe as ambivalence, where they're like, I see some reason to change, but I see some reason to stay the same, right? And we're trying to motivate them to move in the positive direction. And then interviewing, he was kind of strategic about that to eliminate any kind of power gradient. So he thought of interviewing, you could think of if you're a professional athlete like LeBron James and you're being interviewed by the media, as the athlete, you're probably in the position of power, right? Because you can answer questions, you can decide not to answer questions. They're there to talk to you, right? But then he also said on the flip side, if you're interviewing for a job, right? The people in the that are the hiring position or side of things are traditionally in the position of power, right? Where they're evaluating your qualities. Are you a position? Are you a fit for the job? Are they going to offer you a job? That kind of thing. So he said by using the term interviewing, it kind of highlights the fact that this is not one person kind of that's in an expert or a power role telling another person what to do. It's kind of more conversational where it goes back and forth and there's really no kind of power gradient. And it's this general framework of motivational interviewing. Again, just the definition, it's a little hard to see what this kind of how this plays out. But as you'll see, the general framework aligns really well with the core values of PT. So a lot of the things that are kind of hallmarks of motivational interviewing are really some of the core values that we as physical therapists have embraced. So it kind of aligns well with our general approach. So William Miller originally developed motivational interviewing to address problematic drinking behaviors. So here's his original paper describing the approach back in 1983. So it's been around for quite a while, and originally developed to kind of address problematic drinking behaviors. But then clinical psychologists began to use it for other problematic health behaviors. And then it's been expanded into other areas like business, corrections, teaching, a lot of different areas, but then also including healthcare. So, nursing, there's a lot of literature in nursing around motivational interviewing, medical practice, and then also important for physical therapists, right? And I had you read the article by McMee because it's a really nice, I think, intro to the general concept, and it's short and easy to read. But it also does a nice job of highlighting like why we as physical therapists need to have a few different ways of effectively evoking change in our patients. But as you can see here, motivational interviewing, there's been a lot of research surrounding it. This is just from PubMed, one of the databases that kind of indexes medical literature, and this is the number of papers published on the topic. And you can see, starting in 1983 or 1984 when the original paper was published, how there's been kind of an exponential increase in research in this area, where the point in the last year, 2021, or the last full year, 2021, there was 535 papers published on the topic of motivational interviewing in relation to healthcare. So you can see this is a technique that is gaining a lot of traction in the area of healthcare, and there's a lot of emerging research around this approach. So motivational interviewing from a healthcare standpoint is, at this point, a lot of times used to promote smoking cessation, to promote a healthier diet, treatment adherence. That could either be, a home exercise program, or maybe adherence to some kind of prescription of medication or something. How do you get patients to effectively change their behaviors to make sure they're taking their medication as directed, to promote physical activity. And then a lot of times too, there's a lot of literature in the area of glycemic control. So for somebody who is pre-diabetic or has been diagnosed with diabetes, how do they get them to the point where they monitor and then, adopt some health behaviors that'll help maintain a healthy blood glucose level. So this is where primarily it's been used in healthcare, and this is where a lot of the research is. But there's also other opportunities in other specific areas. And motivational interviewing is really helpful when patients are in a state of ambivalence. So again, I've talked about this before. This is when there's kind of in their head, they're making arguments for and against behavior change. They can say, yeah, my doctor wants me to be more physically active, or my therapist wants me to be more physically active. There's health benefits to that. but I don't think I have the time. I don't even know how to get started, all that kind of stuff. So in their own head, they're in this point where they say there's reasons to change, but there's reasons not to change. They're in that state of ambivalence. If a patient doesn't see any benefit to changing, that's probably a point where motivational interviewing isn't going to be particularly effective, right? Because we actually need to get them the information that says these are some reasons why you might need to change, and here is some information that maybe at least gets them started in the point of where they're considering there are some pros to changing and stuff like that. But a lot of our patients come to us and they're in this, again, state of ambivalence where they say, yeah, there's reasons for and reasons for against changing my behavior. Motivational interviewing is really helpful in these instances. And it's also important to note that it may reduce some of the burden on clinicians in that you don't need to have all the answers and you don't need to come across as the expert all the time. So it kind of, it should give you a little sigh of release that you don't have to come there and be, hey, present yourself as the expert all the time to say, here's the information, you need to change, you need to do this, you need to do that, right? It can simply be a conversation where you're in a partnership with the patient, where you're going to say, all right, let's try to figure this out together. It takes some of the burden off of you as a healthcare provider. So again, at a time when, everyone is dealing with burnout and stuff like that, this potentially could be an approach that kind of eliminates some burden from you as Howie's having to be the expert and always having to have the right answers at hand. And I took this quote over here in the bottom right from Miller's book, or actually from his original paper. And I thought it was really nice. So rather than taking the role of savior who shows the correct way, the therapist adopts the role of knowledgeable consultant who gives advice when asked, but does not bear or accept the responsibility of implementing the advice, nor pout if the advice is not followed. I think this is a great quote to kind of sum it up. So instead of being very paternalistic to say, I'm coming here and I'm kind of telling you what to do, that's a lot of burden on you, right? Because it says, I need to know what exactly to do and how to do it and how to get you to change your behaviors. And I'm also responsible for you, right? And if you don't follow my advice, right, it's going to create conflict between you and you. If you're more of a consultant that's there to help guide them through this process of behavior change, you're kind of more of the guide on the side kind of thing. It should help to reduce some of that burden on you, right? So I would say that not only is motivational interviewing been shown to be effective, I think it's got the potential to make your life quite a bit easier as well, which is important when we're dealing with burnout in healthcare. Now we'll talk about the spirit of motivational interviewing, which is probably one of the key takeaways from this talk. If you're going to take away one thing, it's understanding the spirit of motivational interviewing. And it's really around these four kind of key elements of partnership, acceptance, compassion, and evocation. And these are going to be the foundation of motivational interviewing. So we'll talk about some specific skills and techniques, but this is really the core ideas that motivational interviewing is based on. And the reason it's important to understand these, not to memorize them necessarily, but to just understand these core components, is if we lose the spirit of motivational interviewing, we don't understand the spirit of it, where it comes from, right, and how we are trying to use it, it just becomes a set of skills or techniques that are designed to manipulate someone. So for any Disney fans out here, you've got Dr. Fossier threw this in here, right, where you're just trying to, kind of manipulate somebody into doing something that you want them to do, and that can be in their best interest or it can be not in their best interest, right? That can happen if we forget the spirit of motivational interviewing, which again is around partnership, acceptance, compassion, evocation. This spirit of motivational interviewing is really going to be the core, the foundation. And then we're going to layer on specific skills and techniques on top of that. So we'll talk about each of these individually, but again, I'm going to remind you throughout this that really this is where we're going to be coming from, this place of partnership, acceptance, compassion, evocation, when we're actually deciding to use this technique. So first we'll talk about partnerships. So this really describes the nature of the relationship between the clinician and the patient, or the clinician and the client. And so this is that this understanding that both parties bring important insights to the conversation, right? As the clinician, you certainly have knowledge, training, expertise, experience that you bring to the conversation, right? It's not to minimize what you bring to the table, right? But it also acknowledges the fact that the patient is really the expert in themselves, right? They know their history, they know their goals, what their barriers are in their day-to-day life. And so instead of it being a one directional where, the provider is just providing information to the patient, it's bi-directional flow of information where, the patient is sharing information about their history, their lifestyle, their life in general, some of the barriers they see to implementing change. And you as a clinician are there to elicit some change talk, which we'll talk about in some techniques for that. And then also to share your advice about, based on your knowledge and training and experience, when you feel it's appropriate. So maybe the patient asks for it, or you feel it's a good time to interject, right? But the idea is this is a partnership. You and the patient are a team that are working together to help this patient achieve positive behavior change versus I am the expert, kind of a more paternalistic view or authoritarian view where I'm going to say, this is based on my knowledge, training, and experience. This is the best course of action. This is what you need to do. Again, it's a two-way conversation where you're more of a guide than an expert just imparting your knowledge and training on the person, right? They're an active part of their behavior change. So next, we'll talk about this idea of acceptance. And acceptance really involves appreciation for our patient and then their views. And there's kind of four key components to this. Don't worry, don't get lost in these components. Just understand the general idea of what we mean by acceptance in the context of motivational interviewing. But one of these first key components is absolute worth. Every patient that we see has worth, right? They have strengths, they have experiences, they have all these things that are positives that we can make use of in helping them change their behavior. So every patient that comes through our door has worth. The other one is accurate empathy, which is just saying, even if you don't necessarily, you want the patient to change, but at the same point, you can probably understand some of the reasons why they've chose their certain health behaviors, right? You have empathy. Now, it doesn't mean sympathy. You don't always say, oh, I feel bad for the patient, but you can say, hey, they have different life experiences than I've had. They're in a different environment, whatever it may be. I can imagine how hard it is for them to change, right? Or I can imagine why they've adopted some of these negative health behaviors. That's having empathy, right? You can understand, one, that they have worth, and two, you can understand that everyone has different life experiences and different circumstances, and those will shape their behaviors. The third is autonomy support, and this one's critical. We have a human need for autonomy, which is just the idea that we kind of make our own decisions. None of us want to feel like we've lost control over our lives, right? And so we, as healthcare providers, need to support autonomy. And so a lot of what we're going to do, and you're going to see with the techniques, is we're not going to be telling the patient what to do because that takes away some of their autonomy. We're going to be saying, okay, what do you feel about that? And then elicit some of their arguments for and against change to the point where they say, okay, now that we've laid out all the information, what are you going to decide to do, right? It still supports their autonomy. And again, it serves that fundamental need of us being human, of being able to make our own decisions about our health and about everything in general. And the last is affirmation, and we'll talk about this more specifically because this is going to be a key skill as well as these building in affirmations. But this is kind of just acknowledgement that these patients are, have intrinsic tools and skills and characteristics that are worth highlighting, right? And that are going to be helpful for them as they try to change, right? So we may acknowledge how much the patient cares about maybe their family or cares about being involved in their community or getting back to work or whatever it may be, or affirming how hard they're working or something like that. We're really looking at the positive characteristics and the positive behaviors that they're demonstrating And we try to affirm those to say that, this isn't okay, the behavior where we want to change, right? But there are a lot of positives here, and we want to highlight that. So these are some of the core things of acceptance, but just in general, it's an appreciation for our patient in the fact that they have their own views, they have a need to make decisions and things like that, and trying to do things in our interactions with them that support that. Compassion is also part of the spirit of motivational interviewing, and it's really putting the patient's best interest and well-being first. So again, and this is again where this approach really aligns with what our core values are. I mean, compassion is one of the core values of PT. And again, our patient's best interest and well-being come first. And that's when we say it's truly patient-centered. And again, this is another one of those times where it's important to highlight the spirit of MI, because again, a lot of the skills and techniques can be used to manipulate people, right? That's what we're trying to do. We're trying to encourage behavior change, but it needs to come from a place of compassion where we're saying, we're trying to encourage health behaviors, but that is in the patient's best interest, or it's in their well-being is, why we're trying to encourage these behavior changes, not to be, change their behaviors so that it's beneficial for us. So it's not only important to have this at the forefront, but it's also important for the patient to understand that you're coming from a place of compassion. And just in general, this isn't specific to motivational interviewing, but if a patient questions your compassion, they question whether you have their best interests or their well-being at heart, they're never going to trust you. And really your chances of having a positive interaction with the patient are really nil, right? So compassion is a key part of healthcare and being a therapist in general. But again, it's important whenever we're trying to, adopt or apply some of these motivational interviewing techniques. So evocation is really acknowledgement that the patient has ideas, strengths, experiences, etc., that can be used to promote change. So it's really, looking at it more from, okay, something like motivation is not a characteristic that people have or don't have, right? It's on a continuum where everyone has strengths and they have a certain motivation and things like that, but inside of them. But as healthcare providers, we need to do things that pull some of those ideas and pull their strengths and pull their internal motivations forward to the forefront in order to encourage behavior change. So again, this is going to be really showing patients that I'm not here to take care of this issue for you, right? What I'm here to do is to help you pull forward some of your own strengths, some of your own internal motivations, some of your own experiences that will help you in changing your behavior. So again, it's more of a guide versus, I'm the expert and I'm here to fix you, right? So this is a key part. And a lot of the way we approach patients and the language you use and the questions we ask can be used to evoke or pull forward some of the patient's own internal motivators to change. And again, like we said, we do this because patients are more likely to act on their own ideas, right? If a patient says, you know what, I went and talked to that therapist and they told me what to do and they said I needed to do this and they gave me an ultimatum and stuff like that, they're probably not going to change. But if a patient said, I went to the therapist or I went to my doctor, whoever it may be, or I talked to my nurse, and they really talked me through this, and we just kind of had a conversation, and together we kind of came up with the idea that this would be a good time for me to change, and this is maybe how we could effectively do that. And at minimum, they were a part of the process, and hopefully they leave the office thinking, hey, I kind of came up with my own plan. They're more likely to stick to it, right? And it also helps them build self-efficacy, right? If you can show the patient that they don't need to be fixed, they have every tool they need, they have everything they need to change their behavior, they're more likely to stick to a plan when they reach a stumbling block or something like that, or when your episode of care has ended and you're not working with the patient anymore, they're going to say, I still have what I need to be able to, maintain this positive behavior change, because I don't need that therapist there. I have everything I need inside me to be healthy and happy and whatever it may be. So again, evocation is just really pulling those strengths forward and magnifying those strengths so the patient becomes more aware of them. So again, it's critical to understand and remember the spirit of motivational interviewing. And I think regardless of whether you use the specific skills or techniques, it's important to understand these kind of core fundamental aspects because again, regardless of whether you use the skills or techniques of motivational interviewing, these idea of creating partnerships, or sometimes you'll think of those as like a therapeutic alliance. You'll hear that where you and your patient are working together to in their rehabilitation, and things like acceptance and compassion, evocation. Even though they're in this case, I'm presenting them in the context of motivational interviewing. These are really the DNA of all great healthcare providers. Great healthcare providers develop effective partnerships with their patients. They show compassion, though all those kinds of things. So again, just as another reminder here of embracing the spirit of MI or motivational interviewing, yes, it'll be the foundation for this specific approach, but it's going to be important regardless because it's what it takes to be a great physical therapist in this case. So just thought it would be worth reminding again. And it can help you in a lot of different areas. For instance, this is, parenting is one of them. I try to adopt some of these techniques with as a parent, right? Here's my kind of goofy 5-year-old daughter, and she has her own personality, and there are times where I try to change her behavior with bedtime or what she wears to school and stuff like that. And think of it this way, like even some little things that I kind of play around with on a day-to-day basis of supporting her autonomy. She's a 5-year-old and she still has a need for autonomy, and I've learned. So if it's something like, okay, she needs to brush her teeth and then she needs to get her pajamas on, I could say, my daughter's Grace, it's time for bed. Go into the bathroom, brush your teeth, and then go put your pajamas on, right? And that doesn't give her any autonomy, right? It says, I'm dad, I'm going to tell you what to do and you need to do it, right? I'd probably get more resistance than if I said, okay, Grace, it's getting close to bedtime. What do you want to do first? Do you want to brush your teeth first, or do you want to put on your pajamas, right? Those are like the simple things that even if you don't adopt all the techniques and all the skills of motivational interviewing, you can still apply some of these things in your daily life to say, it's still in Grace's best interest to brush her teeth and get her pajamas on, but at least support her role in making that decision about what she wants to do first, versus just kind of ordering her what to do and stuff like that. So there's a lot of little things that I think you can take away from this general approach, that you can apply in your daily life to just make your interactions with your patients, your classmates, your instructors, your kids, if you have them, your family members, more effective, right? So again, that's parenting is one way where I've kind of tried to implement some of these things beyond patient care. But sometimes it works, sometimes it doesn't. So I'll keep you updated as I have more interactions with Grace. So now that we've gone through the spirit of motivational interviewing, let's kind of see how the 30,000-foot view of this process. And really, this is kind of a four-part process. There's engaging, focusing, evoking, and then planning. And so engaging is really kind of developing that therapeutic alliance with the patient, right? It's getting them to feel comfortable with you, getting them to know you, knowing that you're compassionate, those kinds of things. That can happen sometimes very quickly, like within the first session. You've probably had those patients, or you've observed PTs with those patients that you just make an instant connection and you feel like there's trust right away and things like that. Or sometimes it can take a little bit of time, right? But you probably don't want to start trying to address the person's health behaviors until you've engaged them. You've made a kind of connection with them where that they feel comfortable and they know that you have their best interests at heart. So this patient engagement is critical to motivational interviewing, or just, working with patients in general. Focusing is kind of narrowing down on the specific health behavior that you want to address, right? So, it wouldn't really probably be very effective to say we want our patients to be, or we want to work on becoming healthier, right? It's not really specific enough, right, that you can address. You might want to say, okay, our overall goal is to improve your health, but how do we want to do that? What behavior do we want to specifically address? Maybe we start by working with patients to address their eating habits, right? And in that case, we'd say, okay, let's focus on your dietary habits or your dietary selections, and let's focus in on that and make some changes there, right? So that would be focusing, that to kind of hone in on the specific behavior that you want to address. Evoking is kind of one of those pieces that's specific to motivational interviewing to some extent, in that we're going to ask questions that kind of pull forward the patient's, again, own internal motivation, leans on some of their pre-existing knowledge, their skills, their strengths, those kinds of things. And also we're going to do some things that evoke what we call change talk, which is just talk from the patient, comments from the patient that show that they're a tendency to move away from their current state. So we'll talk about change talk, later in this, but it can be as simple as a patient saying, listen, I know changing my dietary habits would be good for my health. That's change talk, right? Because they're acknowledging to us that there are benefits to changing their dietary behaviors, right? So what we want to do is we want to evoke some of those conversations. So that's a big piece of it. And then the last piece is planning. This is, hey, patients made a decision that they want to change their health behaviors. Now this is getting to the point where we say, all right, now let's start to come up with a plan together for how we're going to do that. Are we going to use a diet log? Are we going to, get you into a support program? What are we going to do to help support this, right? And this is key. We don't really go into the planning stage until the patient has already made the decision to change their behavior, right? Again, we don't want to get into the point where our first thing is saying, you need to change your behavior and we need to figure out a way to do it, right? We're going to be more effective if the patient comes to the realization that, yes, I do need to make some changes in my life, whether that's in my physical activity, my diet, my smoking habits, whatever it may be. And then once they've made that decision, like they've got over the hurdle of saying, yes, I need to change, then we move into this next phase of kind of the planning part of it. So again, these processes aren't necessarily unique to or specific to motivational interviewing. We'll always want to engage the patient. There's probably always benefits to focusing on a specific aspect of their care that you want to work on, evoking, planning, those kinds of things. But this is just kind of the key parts that you kind of want to know where you're at in order to figure out when you start to actually implement some of these motivational interviewing techniques. So now that we've gone through kind of the spirit of motivational interviewing and then the kind of a big picture of when the motivational interviewing gets incorporated during the patient interaction, now let's talk more about some of the core skills of motivational interviewing. And they're typically used as OARS acronym to describe some of the hallmark skills of motivational interviewing or hallmark techniques. And that kind of stands for open-ended questions, affirmations, reflections, and summary or summarizing. So we'll talk about each of these specific core skills in the next couple slides. So open-ended questions are questions that can't be answered with a simple yes, no, or a single word, right? So, these here in this table, there's kind of examples of open-ended and closed-ended questions. So a closed-ended question would be something like, are you in pain, right? Because they can answer that, yes, I'm in pain, or no, I'm not in pain. A more open-ended question would be, how are you feeling, right? And the patient may report pain, but again, you allow them to elaborate a little bit. Same thing with these kind of questions related to activity and stress. How does being active does being active reduce your stress? Again, that's a closed-ended question, yes, no. Versus a more open-ended question was, how does activity affect your stress level? So again, in motivational interviewing, we tend to more heavily rely on open-ended questions. And usually they'll start with, what, how, tell me more. And the reason we rely more on these open-ended questions is it encourages more thoughtful reflection. So instead of saying, are you in pain? And they just kind of respond, yes, no, it says, how are you feeling? Well, that requires you to say, well, how am I feeling? I'm in a little bit of pain. And then they may even elaborate in different ways. And I feel stressed and I feel anxious and I feel depressed and I feel like I've lost hope because of this pain. You're just going to get a richer response when you rely on some of these more open-ended questions. Again, this is the idea that this is really a conversation with the patient. That's what it's meant to be. And you're hoping that with that more thoughtful reflection, you can also listen for and hopefully invoke more of this change talk. Right? So they might tell you, how does activity affect your stress level? So this question right here. instead of just saying, yes, it affects my stress levels, or no, they may say, you know what, I think when I'm more stressed, I tend to, or when I'm less active, I tend to be more stressed out. I think activity is a form that I use to control my stress levels. And they may then even go into, you know what, I haven't been able to be as active lately, and I notice my stress isn't being managed as well. That I think I need to get back into getting into a better routine as far as physical activity. Notice how they've already brought up some of those ideas of change talk. They've already said, you know what, I think I need to start, getting into better habits. I know this plays a role and stuff like that. Again, you're going to promote some more of that discussion through an open-ended question than you are, just simply asking these closed-ended questions. And again, that's really to get the conversation going and to have a richer dialogue with your patient. So then affirmations are statements that point out strengths or values that the patient's demonstrating. So it helps in a lot of ways. One is, with that engagement, but other, it promotes self-efficacy and feelings of self-worth. Again, those are things that we want to instill in our patients, that you have everything it takes to change your behaviors and to be happier and to be healthier, and you're worth being, your life is worth it, kind of thing. And we want to accentuate the positives. We don't, and affirmation is not the same as just a compliment, right? You don't say, hey, I like your shirt, right? It's to say something that is a kind of characteristic strength or a behavior that they're showing that is worth highlighting, and makes it clear that they have a lot of strengths that are required for them to change their behavior. So for instance, if we're working with a patient who's a caregiver, and his wife requires a lot of assistance, and he's worried that it's like, I just don't think I can help as much as I could before. I'm starting to decline in my own right, and I can't help her with transfers anymore and stuff like that. First of all, it takes a little empathy to say, like, maybe I haven't had that experience, but I can imagine how hard that is, right? And so an affirmation may be, to say, it's clear to me how much you care for your wife, right? Because they're exhibiting that. They're, by showing you or telling you their concerns, they're showing you that they really do care for their wife. They're worried about not being able to take care of them and stuff like that. And so you want to affirm that. You want to say that is a very noble thing, and we want to highlight that, right? And that's something we can build on, right? You really care about your wife, and that's something that we need to figure out ways that you can kind of take care of yourself so that you can take care of your wife in that process and things like that. Those are kind of affirmations. It's those statements that, highlight a strength or a positive behavior of your patients. And so you'll see these. This is kind of a hallmark of motivational interviewing and just patient interaction in general. You want to, as I kind of quoted here, accentuate the positives in your patients. Patients, a lot of times when they see healthcare providers, they're going to get a laundry list of all the things they're not doing, right? All the things they should be eating and they're not, all the habits they should be getting this much sleep, and they should be doing this, they should be active this many hours a day, that kind of thing. You know what I mean? And that can be demoralizing sometimes. And so affirmations help us to say, you're doing a lot of the right things, and you have a lot of great characteristics that are going to help you be successful moving forward. So affirmations are just a good habit to get into of pulling these forward when you're interacting with patients, but they serve a key purpose with motivational interviewing. Reflections are a key aspect of motivational interviewing, and probably just a good habit to get into in general when having a dialogue with patients. And so what it is it's an attempt to understand what your patient's thinking, feeling, and then reflecting it back to them in a statement. And it can be very simple, where you kind of just repeat it back, kind of parrot it back to the patient, or complex, where you kind of paraphrase. They may give you a few different things, and you say, so to me it sounds like ... And what it does is it helps to convey empathy, right? You're kind of looking at it and saying, I'm trying to understand your situation by putting myself in your shoes. And it also conveys understanding, right? You're saying, okay, let me make sure I understand that. And people really appreciate that. This is a key part of motivational interviewing, but again, it's a good habit to get into in general when you're working with patients. When they express a concern, try to repeat it back to them, right? And the other benefit of this is if you repeat it back and they say, no, that's not what I meant at all, right? It can help clarify things. So there's a lot of benefits to these reflections. So this is just an example of maybe a little bit more complex reflection. So a patient tells you, I know I need to exercise, but I'm too busy. So as a clinician, you may say, so you're interested in exercising, but you need help to figure out how to fit it into your schedule, right? Because really that's what they said. They've said two things here. I need to exercise, but I'm too busy. So you're paraphrasing that and maybe expressing it back into a different light to say, you know it's important, but we need to figure out a way to get into your schedule, right? So that's an example of a reflection. They're expressing something to you and you're kind of reflecting it back to them. So now a summary is just a longer reflection of multiple patient statements. So, patients have a lot of times when they've talked to you, they've expressed a lot of reasons to change, and then they've expressed some reasons not to change. So we'll talk about this in a couple slides, but more change talk versus sustained talk. And what we can do is we can summarize that for them, and we can strategically guide patients towards change by selectively summarizing their own reasons, right? So we can say, okay, let me get this clear. So you think it's important in this way, and you think it's worth changing because of this, but you think these are some of the barriers. And again, you can weight some of these things differently to try to encourage change in the positive direction. And then you also want to end with a close-ended question. So, something like after you've summarized, does this sound right? Does that make sense to you? Is that what you were meant by this? And what you're doing with these summaries, there's a few different things. One is you can help to effectively lay out kind of the pros and cons of change for your patient. And sometimes they'll say a lot of things during a session, and just summarizing it all at the end can help them see all the reasons to change and then also express the reasons not to change. And then also it shows that you're listening, right? You're not just with your notepad doodling, you're listening and you're trying to understand their state of ambivalence and what are the reasons they want to change and what are the reasons they don't, right? And you're just reflecting that back to them. So these summaries are a really important part of motivational interviewing, and probably another good practice to get into or habit to get into when you're working with patients is just, when you're done with the session, kind of summarize what was said and what you heard from the patient to make sure you're all on the same page to some extent. So this is just an example from a common scenario when you're working with patients is, let's say you're working with a patient who's had multiple falls and you think that it would be best for them to start using a walker, but a lot of patients don't want to use a walker. They don't like the way it looks. It makes them feel old, that kind of thing. They may not have friends that use walkers. So it's a tough conversation to have with patients. And so this is an example on the left of what the conversation with the patient might be. So they may express, I don't want to use a walker, it'll make me look old, but I worry about a fall, and a walker would be helpful, especially when I'm out shopping with my daughter, but it would be hard to get into the car. So you can see there in that short statements, or in that series of statements, they've expressed some reasons to change, that or in this case, use a walker. It'll reduce their risk of fall. It'd make it easier when they're out shopping with their daughter. But they've also expressed some reasons not to change. They're worried about how it'll look. They're worried about how effectively they'll be able to transport their walker. So as a PT, you're not going to, or as a clinician, you're not going to judge that, and you're not going to say, based on what I'm hearing, it sounds like you need to use a walker, right? What you want to do is something like this on the right. So you'd say, so you're worried about falling and think a walker would be helpful. You also think a walker would make it easier to shop with your daughter. However, you don't like the way a walker could make you look and think it could be difficult to transport. And then you'd want to end that with a closed-ended statement. So does that sound correct? Right? And so again, what you're doing is you're laying out the pros and cons for patients and then showing that you're acknowledging the fact that all of the statements they've expressed are valid and that you've been listening, right? And this is an important part. And I've had the example, or that I've had the scenario sometimes where once you kind of lay these out and patients just kind of hear it reflected back to them, they'll say, now that you say it out loud, it just kind of feels silly. You're right. I probably should use a walker, right? Or it makes sense to use a walker. I don't, it's not as important about how it makes me look. So sometimes that happens just kind of when patients hear it back to you and they hear their own pros and cons expressed back to them, they'll kind of say, yeah, now that I hear it, it's like, yeah, it's probably worth trying to use a walker, but that's not the purpose. The purpose is really to show them that you're listening, to acknowledge that there are reasons to change and there are valid reasons not to change as well, and that you can kind of lay those out and then maybe say, you know, let's accentuate the change talk. So these are the benefits, and let's try to navigate around some of the barriers that are identified in the sustained talk. So I've already alluded to this quite a few times in the presentation, but let's talk a little bit more about change talk. So what change talk is it's patient statements that favor action versus inaction, right? And hopefully in the positive direction. So these maybe usually start with something like, I want to be able to do this. I wish I could. It would probably be helpful. That's usually the siren should be going off in your head that, oh, there's some change talk. And we want to listen for these statements throughout the discussion. So the patient is talking to us, we're having a dialogue with them, and we're listening for some of this change talk. And then we're going to reiterate it during our summary, right? So we want to kind of accentuate a lot of times the reason for change. And just in general, the more change talk, the more likely it is that the patient is going to take action, right? And they're going to change. So if we're talking to a patient and, they say, I'm having a hard time, quitting smoking. I know it's important. I've quit in the past. It just can't make it stick, that kind of thing. I wish I could just, get through this and stuff like that. There's a lot of change talk there, right? They're telling you that it's important. They're saying they've tried. They're saying that they've been effective in the past. They just haven't been able to maintain it and stuff like that. That's a person to me that says, man, there's a lot of change talk there. It might be the other person that says, I I don't have any interest in smoking. I don't really think it's important to me. I've been smoking my whole life and I've never had anything bad happen. And you know what? I'm not willing to change. You know what I mean? That would be a person where you're having that dialogue and you're like, I'm not hearing a lot of change talk. It's going to be really hard if you're not hearing that kind of change talk to really, apply some of these motivational interviewing techniques and really get them to change because they don't really see the importance. They don't think they have the ability or the want to, right? So in that case, you're kind of listening to say, okay, how much evidence is there from our dialogue that this patient is in a state where they're looking to make the next step of moving forward? And then, a lot of times change talk just happens authentically, right? When we're having discussion with patients, but we can also ask specific questions that promote change talk. So, this would be an example of, instead of just saying, how do you think smoking is affecting your health or your breathing, or your whatever? You may say, what are the reasons to stop smoking, right? So this is automatically going to generate some change talk because you're asking them, what are the reasons to change, right? So change talk can either happen kind of authentically, or we can ask specific questions that kind of promote some change talk. So in the example I just gave you of the person who said, hey, there's no reason to change. I've been smoking my whole life. If nothing's bad happened, maybe at least a strategy to try to get some change talk going is to say, so you don't see any reason to stop smoking? And they may say, well, yeah, I mean, I know are some health benefits, and yeah, I probably breathe a little easier and stuff like that. And I have noticed I get winded, a little earlier when I start going upstairs and stuff like that. So you can ask some of those specific questions that try to encourage that type of change talk. So again, we listen for it to see if it's coming out automatically. And then sometimes we ask questions to try to pull it out, essentially. Um, so now it's good to think of change talk and sustained talk, which sustained talk is just, statements that favor inaction, right? Like, yeah, I could do it, but you know what, my health isn't that bad right now. Or, like the walker scenario, I don't like the way it looked. With any conversation with a patient, there's some mix of change talk and sustained talk if they're in a state of ambivalence. And what we're trying to do is weight the scales or push it over so that the change talk kind of outweighs the sustained talk. Because it's almost like if you're a Malcolm Gladwell fan, he would call it almost like the tipping point, right? Once you get to the point where the change talk starts to really outweigh the sustained talk, that's where you can get over the point where the patient says, you know what, yeah, I'm going to really make an effort to make a change here, and let's start to plan what that could look like. So what you're trying to do is encourage that change talk. You're trying to accentuate what they're saying in the reasons to change, and you're hoping to get to a point where that change talk kind of overcomes any of the reasons not to change, any of the sustained talk. So it's kind of a balancing act. And again, with motivational interviewing, there's some specific techniques we can use to encourage patients to express their own reasons to make a change, and then also think about some of the ways they can overcome any barriers to changing or any stumbling points they may have. So these types of scales are a tool that's commonly employed with motivational interviewing. So when you're asking a patient to using one of these scaling questions, you're not just saying, are you interested, or do you think this is important? Yes, no. You're asking on more of a continuum. So this is just a 10-point Likert scale that says, if you're asking how important it is to change, patients would rate 0, not at all, to 10, very, right? In this case, this scale has a question about how important it is, how confident they are in their ability, and then how interested they are in changing. Again, because these are different aspects of change. A patient could think a change is very important, so they could rate a 10 on the importance scale, but their confidence in their ability could be a 1, right? So that's a patient that knows it's important for them to change, but their confidence in their ability is low, right? And so you may treat that patient differently, or you may engage with that patient differently than a patient that reports that they don't think the changing is very important at all. They rate it as a 2. The way those two interactions look may be quite different. And so there's a lot of benefits to the scaling. One is that you can track changes over time, right? So as you intervene, just like you would with strength or range of motion, you can track things like self-confidence, or self-efficacy. So let's say day 1, patient is a 2, and then you do some strategies to, let's overcome some of these, try to overcome some of the barriers, and let's come up with some strategies. And you would hope that over time they build up confidence in their ability to change their behaviors, right? So you might see that they start as a 2 and at the end they're an 8, right? Or after a couple of weeks they're an 8 because you've helped them eliminate some of the barriers and you've helped them, create them an environment that will help them be successful. The other thing is it can encourage some interesting dialogue and allow you to elaborate a little bit. So as a patient, let's say their confidence, they report certain health behavior like becoming more physically active, and they report a 2 out of 10. So they're not very confident. And you may say, okay, what would we need to do to get you from a 2 to a 5, right? To slide up the scale, to go from leaning towards not very confident to being somewhat confident. And the patient may say, that's a good question. I don't know. I hate working out alone. I don't know how to even get started. And they'd be like, well, what if we could find somebody who may be able to work with you a little bit to get you started? Or, do you have any people in your community or friends that exercise? Do you think they'd be willing to kind of start a program with you together? And a lot of times, if you can eliminate those types of barriers, patients will say, yeah, I'm probably more confident that if I had somebody to do this with, that I could go from a 2 to a 5. It increases my confidence a little bit. So it's those kinds of things that you can also allow you to kind of brainstorm what are the additional barriers to being higher or on the other end, lower on this certain scale. The other thing is it can also generate confidence or interesting conversation. So let's say, again, you're working with a patient about and talking about, potentially interest in smoking, quitting smoking. And, they say, it doesn't matter, that smoking's not a big deal. And you say, okay, where would you, quitting smoking, where would you rate it on a 0 to 10? And they would say, a 2. So, they don't think it's very important, but you could also have the conversation. So you rated it a 2, you didn't rate it a 0, which is not important at all. So tell me about that. And they say, listen, I get that, smoking is bad for your health and it's probably, not doing me a lot of good. I probably get winded or easier than I would if I didn't smoke. I probably could be more active and all that stuff. So I'm not saying it's not important at all. I'm just saying it's not my top priority. You know what I mean? That can lead to a different conversation than just saying, is it important to you? No, right? So again, these scaling questions, you'll see them used in some of the videos, and this is a nice technique to encourage, again, more deeper dialogue when you're talking with patients. Again, where they're at on this continuum of change, and then what it would take to move them up or down this scale. Okay, before we start moving forward and talking about some of the more specifics and watching some videos and actually trying to apply some of the techniques ourselves, here's some general tips. So one thing is to consider the patient's stage of change. So typically this works best, motivational interviewing works best when patients are in kind of that contemplation stage. So they're in that state of ambivalence where they say, I see some reasons to change, I see some not reasons not to change, and you can help them work through that ambivalence and get to the point where we've kind of hit that tipping point where now all of a sudden we're going to get more into the action stage. That tends to work best when they're in the pre-contemplation stage, like they don't even, there aren't any reasons in their mind to change. Usually applying these motivational interviewing techniques at that point is a little premature, I think. Same thing if they're in the action stage. If they've already taken action, then it's kind of like get out of their way and help support them, right? To figure out where there's any things that are making it harder for them to maintain their changes or things like that. But they've already gotten to the point where they've realized that they need to change and they've already went into action, right? So motivational interviewing wouldn't be very effective in that stage. So it's kind of in those earlier stages where they've come to the realization where there might be some benefits to change, but there might also be some drawbacks. You can help them resolve that. So again, thinking of the stage of change is probably critical when deciding whether you use this approach as motivational interviewing or something different. The other thing is resist the writing reflex. So there's a lot of writing reflexes you're going to learn about with postural control and things like that. The writing reflex we're talking about here is just our natural tendency to try to fix things, right? We went into PT or healthcare in general because we wanted to help people, right? And so when you hear somebody has a problem or you think that some of their lifestyle choices or their health behaviors are affecting their health, our natural tendency, especially if we know something about the topic, is to jump in and swoop in and save them, right? And again, we talked about that. A lot of times that can have negative consequences. It can actually entrench people in these poor health behaviors. So we need to resist the writing reflex, right? And that can be hard to do. Trust me, sometimes you won't be able to avoid the temptation. And then the other one is refrain from giving advice unless asked. Again, this is hard to do, right? You have a lot of knowledge, you have a lot of good training that you're going to develop over the years, and you have all this in your head, and your tendency is going to say, I know what you need to do for this, right? But again, we want to elicit the patient's own ideas and really stoke the fires of their own motivation. And so it's not to say that you don't add in your advice and you don't consult patients, but you try to make it at least to some extent on their terms. So the patient may ask you and say, you know what, I don't know, where to even get started. And it may be then you see, hey, that's my time to jump in. You know what, this tends to work for most people, or maybe I've had patients with this where this tends to work. That might be your ticking point where it's like, hey, this is where I jump in and give my advice. Or if you are going to elicit or, offer your advice, maybe even ask the patient first. I know that seems a little counterintuitive because they're there to see you, but it says, do you mind if I give you some advice? And you just then share your expertise. Sometimes that of giving patients that autonomy that, they'll get your expertise and they'll get your consults in on their terms can be effective for creating a good working relationship. And then do your best not to judge, right? This kind of gets into that idea of, that everybody has worth and that we have to value our patients' opinions and try to have empathy. And you see the last one down there, practice empathy. It kind of goes in the same realm of we have to understand that we may not always approve of certain health behaviors, but at the same point we have to have empathy for that person has the right to choose their own health behaviors, right? And we have to be careful not to judge that. We need to try to understand it the best we can, and then try to help them through a process of changing those health behaviors, right? Without label them as being non-compliant or drug seekers or malingers or whatever it may be. We need to try to understand the behavior, and for that, it takes us having an open conversation with them, right? And then not in order to have an open conversation, they really can't feel like they're being judged, right? Because they're not going to open up to you, tell you what their issues are if they feel like you're judging them and you're labeling them and you're not on their side a little bit, right? So it's important to kind of not be a judge and then to practice empathy as much as you can. try to put yourself in the patient's shoes. Again, empathy versus sympathy. You're just trying to understand where they're coming from a little bit. So these are just some general tips, and you're never going to be perfect on these, right? I mean, as a healthcare provider, these are important, but at the same point, you're going to have times where you chime in with your advice when it probably wasn't warranted. You're going to try to swoop in and save the day, and sometimes it's going to backfire on you. You're going to have to resist every urge to label patients in some manners and stuff like that, because you're going to have difficult patients and stuff like that. But so you don't have to be perfect on this. I think it's worth trying, right? And doing your best to make sure that you're listening and you're having empathy, and you're doing your best to understand where your patients are coming from. So if you can do those things, I think you'll have some success with these specific techniques, or this specific technique in particular. So this is just some text from a paper, just an example of how this dialogue could go of applying motivational interviewing. So this is from a paper. I'll kind of post the paper. You can see the reference down here in the bottom right corner, but this is part of one of their appendices. So I'll post this paper at the end of the module, and it can be nice to look through this, but I thought it'd be a nice example of, let's see how some of these components kind of play out in a conversation. So you can see the PT's text or dialogue is in yellow, and the patient, in this case, Mary, they named her, is in purple. So the PT says, good morning, Mary. It's good to see you again. During our last visit, we began talking about your exercise habits. So Mary says, I've never been much of an exercise person, but I know I should probably try harder to help control my diabetes and lose some weight. It seems like I can never stick with it on a regular basis. So in that phrase there, you see there's some change talk, right? I should probably try harder. You see that's kind of leaning towards change, right? Same thing, that it would help to control my diabetes and lose some weight, right? If I begin to exercise. So there's a lot of good things here, even in those two short statements. So as the PT, she's going to kind of, or he or she is going to kind of reflect that back. It sounds like you have some concerns about your health, but find it hard to be consistent with your exercise. So think of that as kind of a reflection, or even a summary, right? Because there was multiple statements there of saying, okay, you have concerns about your health, but you also, and you think that exercise may be helpful, but you're having hard times being consistent with it. And then Mary says, yes, it has always been a struggle. No matter how hard I try, it just doesn't seem like it's worth the effort. My diabetes and blood pressure don't really get any better. And the PT's response is, it's hard to stick with certain activities that you don't see immediate benefits. So this is an example of an affirmation, right? The patient has expressed to you that they've tried, right? They really have tried, but it's hard when they're not seeing notable improvements. And as a PT or as a clinician, you know that's true. We've all tried things, and if you're not seeing immediate benefits, it's hard to stick with it. So you're affirming that is a valid feeling, right? And that'll help that patient understand that you're not judging them and say, you're just a quitter or you need to try harder, right? You're saying that it is hard when you're not seeing immediate benefits. It's an affirmation for the patient. And Mary says, well, I know that being active is important. Again, more change talk. But there are so many other things to do that take up a lot of my time, like taking care of my grandchildren and church activities. And the PT responds with, your grandchildren and church must be very important to you. Again, affirmation, right? This is positive. This patient takes care of their grandchild. They're committed to their church activities. Those things are important to you, right? So it's a nice affirmation statement. Mary says, I recently became the guardian for my granddaughter, so she lives with me now. She is so active and I get tired pretty easily. I would really like to play with her more, but my low energy and my weight make it hard. And PT responds, I can hear how much your granddaughter means to you. Again, affirmation, and that you want to be healthy for her, right? Again, encouraging that change talk and kind of accentuating it, right? That she wants to be healthy because it'll help her do something important, which is, interact with her grandchild. What do you think you can do to make playing with her easier, right? So there's an open-ended question. You're not saying, if you were more active or you were more physically active, you'd be able to play with your granddaughter more easily, right? You're saying, what do you think you can do to make it easier, right? And that's one of those questions, those open-ended questions that starts to encourage some dialogue. So now continuing on the next slide. So Mary says, even if when I get tired, or even though I get tired, I know regular exercise would help give me more energy. And if I could lose some weight, that would probably also help. But I would have to start off slow. So again, a lot of change talk in that statement. So PT comes back and says, what's that saying? Slow and steady wins the race. How confident are you that you can start slow and keep it going on a scale of 1 to 10, with 1 being least confident and 10 being most confident? So again, here you're starting to see that scaling question, right? And Mary says, I would say 7. So as a PT, you're saying, hey, that's closer to 10 than it is to 1. That's encouraging. So the PT responds, okay, why did you choose 7 and not 2? So Mary says, there's a group of women who go to my church who have been talking about starting a walking program or a walking group. They also had the idea of talking to the church pastor about doing an exercise group for seniors a couple days a week in the church parish hall. We can all start slow together. I think the support of my faith community and wanting to be more active in my granddaughter's life, I will be able to be more committed to sticking with the plan. PT responds, that's great, Mary. I'm really glad that you found a way to fit exercise into your life that you feel will work for you. So again, the PT didn't really come up with the plan. Mary came up with the plan, right? And it was just kind of this thoughtful back and forth that led her to that. She came in that session and wasn't even really sure she wanted to change, right? And now we just in a few back and forths, we've gotten to the point where now she's actually got a pretty reasonable plan in place that she developed that is she's more likely to stick to, right? And then she follows it up with, this is really the first time I've been a little excited about exercise. Why do you think she's excited? Well, because we've highlighted that if she can be more active, she can be more interactive with her grandchild. We know that's very important with her. And also she's come up with a plan that allows her to tie in her activity with something she loved, which is being involved in her church, right? And again, that's not our plan, that's her plan. We've just helped guided her through this process. And then her last part I'll talk to my friends and the pastor and see if I can if we can start to make some plans. Maybe at our next appointment, you can help me set some goals to work towards that I feel like I'll be able to do. So again, she leaves the door and she has something she needs to do to get the ball rolling. We have really gone here from kind of pre-contemplation to really action. She's taking action here in that she's starting to organize a group. She's going to contact the group of women that go to her church and stuff like that. So there's a lot of good things that happen here, but hopefully in this little brief dialogue here, you saw a lot of those, open-ended questions, affirmation statements, reflections, examples of scaling questions. So keep an eye out for these. Again, the rest of the module, there'll be quite a few different videos of different scenarios where, healthcare providers are applying these motivational interviewing techniques. And as you're watching through them, see if you can identify them, because I think it'll give you some ideas for how you can implement these different strategies when you're starting to work with patients on your own. All right, so the last thing we'll talk about before we wrap up this part of the presentation is the use of some of these concepts in helping patients make difficult decisions. So, our patients a lot of times have to make decisions, and there's really no clear right course of action, right? So when we're talking about behavior changes, we kind of know that it's probably a good thing for our patient if they become more active, if they, eat a healthier diet, if they quit smoking. But a lot of these kinds of these principles that we've talked about and some of these specific techniques can also be applied when we're helping patients make tough decisions where there's not really a clear answer. Right? So just as my example of a patient that's deciding whether to go the route of treatment versus hospice care, right? And they're thinking about, let's say we have a patient that has cancer and they've, gone through different rounds of treatment and, it hasn't really showed much progress. Maybe they're getting a little pressure from their kids who love them and want them to be around as long as possible and are trying to get them to pursue every treatment possible. And sometimes you'll run into these scenarios where patients are just like, the treatment itself is making me miserable. I would just give anything for 3 more months of not being sick and every day and having no energy because I'm participating in therapy and really I just want to spend these last 3 months with my grandchildren or something like that. As a healthcare provider, we kind of lean towards always saying, let's try to work through this. There's always a cure, right? And the reality is we need to have conversations with our patients to understand what they want out of the time they have left. There's a great book. It's worth reading for sure, especially when you're on break. Atul Gawande's Being Mortal, where he talks about this of, helping patients with end of life decisions and things like that. But won't get into this in detail here, but I think it's important to at least touch on here because I think things like motivational or some of the concept we've talked about in this lecture can be helpful in this case. So again, if we're working with a patient of that's considering their options for treatment versus hospice care, we can use some of these things like open-ended questions to try to get to the idea of what do they truly want out of the time they have left. Or affirmations, like if they're having conflict over, yeah, but my kids will be mad at me because they want me to keep going with treatment and they're going to think I'm giving up. And, those affirmation statements of, you know, about how hard they've worked and how much they care for that they want to spend these last 3 months with their grandkids or whatever it is. A lot of those concepts can help patients navigate towards the right decision for them, right? And that's the goal, not to come into a patient's room and tell them, there is a certain percent chance that this could be effective. That means that's the course of action for us. No, it's really having conversations with the patient and saying, what's important to you? What do you want to prioritize? There's risks and benefits to anything. What do you think is the best course of action? Having that dialogue. And so again, typically we think of motivational interviewing as creating behavior change, but I think a lot of the principles can help us when we're having conversations with patients that are faced with very difficult decisions. I think we can make use of a lot of these principles. So I thought it would be worth highlighting here. All right, so let's finish with a take-home message. So motivational interviewing is a patient-centered, evidence-based method for promoting behavior change. The key is to remember the spirit of motivational interviewing, or otherwise it just becomes a list of techniques or skills to try to manipulate. But there are some techniques that can help us improve our effectiveness. But this is the big point here is the key is to gain some experience in real life situations. So part of what you'll do through the rest of the module is you'll watch some of the videos of these techniques being applied. You'll try to apply them in kind of mock patient scenarios with a partner. And then the other piece is, you have the awesome opportunity to be involved in care. So, over the next couple of years, even before you'll be out with in your terminal internships, you'll have some opportunities to look for opportunities for behavior change with your patients and start to apply some of these techniques, because that's the key. I think you'll probably agree after going through this talk, none of the concepts are that complex. But it is challenging. These are tough topics when you're talking about patients about, they're coaching them through weight loss or, diet changes or activity changes or all those kinds of things. That can be really challenging conversations to have. So, the difficult part isn't the concepts, it's the application. So you have your opportunities in front of you as you're working in care, and then obviously as you get out into your long-term clinical internships. But that's going to be the key is you really will only get effective at applying these techniques if you kind of take the opportunity to practice. Okay, thanks.